am in Chicago, Illinois, and about to take the final step, the final exam to becoming board certified. It's been a long journey. To get to this point, as you guys are aware, it takes 4 years of college, 4 years of medical school, and 6 years of surgery training. One of those years is a fellowship. And then after your second year out in practice, you take your oral boards. The American Board of Orthopedic Surgery, the board examination process, it all starts you have to pass your USMLE Step 1 board exam after second year of medical school. That's an 8-hour exam. And then you take Step 2 after your third year of medical school. That's an 8-hour exam. And then you take Step 3, which is in your intern year of residency, and that's a 2-day test. Both of those days are 8 hours, and I have videos about all of those, and I'll put that right up here. And then each year as a resident, you take what's called a shelf exam. That's 5 8-hour exams throughout residency. And then after residency, after you graduate, you take your Part 1 of the American Academy of Orthopedic Surgery boards, and that is an 8-hour or 9-hour exam. So lots of exams to actually get to this point, and this is the final step. So after you pass the written portion, which is an exam that tests your knowledge in orthopedic surgery, your surgical knowledge, your anatomy, histology, microbiology, pharmacology, all of that in terms of taking care of patients from an orthopedic surgery standpoint. After you pass that, then you go out into practice. So I'm in private practice. I've been in practice for almost 2 years. And it's at this point where you take your oral boards. And some people realize and think that, hey, he's out in practice, he's doing surgeries on his own, and he's finished all of his training. That has to be the end of the exams, but it actually, you go through these exams pretty frequently throughout your training, as I mentioned, but no, it's not over quite yet. So this is a 1-day oral examination where they look at surgeries over a 6-month period, and you have to turn in all of your surgeries, your operative reports, your history and physical, your HPI, your x-rays of that patient, their MRIs, CT scans, and they look at every single case, and then they select 12 of those cases. And then today I'll present those 12 cases to a board, to a group of spine surgeons, and they will critique me. They'll ask me questions. What's the literature show about spinal stenosis? How is it best treated? Why did you do this approach anteriorly in the patient's cervical spine? Why didn't you do it posteriorly? What complications that you had? And they just drill you with questions. It's can be very intimidating, but someone asked me, was I nervous? And I'm not really nervous. I am just really anxious to get it over with. Some people fail. I've known people that have failed, and if you fail, you essentially have to go through that whole process again, which is a really tedious process. I probably spent about 40 hours putting together all the documents, getting consents. You have to get approvals from the hospitals. You have to get approval from the patients to use their information. Just reviewing, the documents, the requirements. We had to pay money. I think it was like $1,200 to $1,500 to even sit for this oral exam. So the oral exam, it's every year in Chicago, same place, same hotel. And in preparation for it, essentially what I do is I read a lot of articles, talked to a lot of my mentors, reviewed my cases. I went through all of their history, their physical, make sure I know it kind of to the T, and I took notes. So these are my notes here. I won't get too close because it has a lot of patient information, but you can see that there's diagrams of osteoporosis, what medications that we use to treat osteoporosis, the recommended levels, vitamin D and calcium. I have CT scan information, spinal stenosis, fusions, instrumentation, what size screws I use, what size cages in these cases. And this is what I'm reviewing essentially for the next last day or so up until the exam. So the exam starts in about an hour, and I will go to the examination site to take this exam. I pretty much have memorized, for the most part, all of my patients that I saw and did surgery on. There were 12 of them that they picked out of, I don't know how many I had. If I had a wild guess, probably 80, 70 cases over a 6-month period. But this is it. If I pass this, I'm board certified orthopedic surgeon, which that'd be really good. So my advice for students out there: don't look at the kind of each step that you have to take, the long-term step. Just take it day by day, exam by exam, test by test, course by course. You'll get to this point. It just takes a lot of work, a lot of effort, but it is certainly a lot of fun, especially to take care of patients, and also to the gratitude and the satisfaction that patients get when they come to my office in very severe pain and I'm able to help them. So I have another video about how I prepared for my part 1, which is the written exam of the American Board of Orthopedic Surgery. I used notes just like this. I actually had a Word document. I don't know how many pages it is, but it was pretty long, and I just studied that right before my exam. So I did something similar for my oral boards. But this is the reason why I'm in Chicago. I'm going right back to the airport right after this, and I have clinic tomorrow. Very busy clinic, and then we have a lot of patients to see, so I have to get back. I think I'll land around 11:30, 12 tonight, and then clinic starts 7:30, 7 a.m. in the morning. So this is Dr. Webb. We'll see you next time.